Hi everybody, I'm Dr. Jon LaPook and welcome to CBSDoc.com. In the wake of Michael Jackson's death, there's been a lot of discussion about the medical care that VIPs get. And today we want to talk about that. One would assume that VIPs would get better care than normal, but that's not always the case. And I have with me today Dr. Baron Lerner, who is a professor of medicine and public health at Columbia University Medical Center and an expert on this subject. In fact, he's written a book called When Illness Goes Public, Celebrity Patients and How We Look at Medicine. So welcome, Baron. Thanks for coming.
Thank you, John.
What is it with VIPs? Do they get better care, worse care, or somewhere in between?
Well, I think in some cases they do get better care. They have more money, they have access to great doctors, and they can go to the best medical centers. And so that is often the case. But it's not always true. If you're a famous person and you go into a doctor's office, the tension may be there, that things can change a little bit. And doctors don't normally do what they do with average patients. And celebrity patients may want to change the rules a little bit too. So ironically, in some cases, celebrity patients, I think, wind up getting worse care.
If I see a VIP, I do a spiel, a standard spiel, which is, look, I know you're a VIP, but my goal is to give you every bit as good care as I give my clinic patient. Because once I start deviating from my normal practice, I'm being thrown off my normal game, and then you might get worse care. Give us an example of a celebrity who got worse care.
Well, there's one sort of famous example that people talk about a lot, which is Andy Warhol. He was a famous artist and was hospitalized here in New York for a simple gallbladder operation. This was, I think, in 1985. What happened after the operation, we still really don't know, but he was basically found dead in his room. It turned out that he had
in the hospital.
In the hospital, after the operation. He had a private duty nurse that he'd hired, and it turned out that the regular nurse hadn't really been in the room as much. Now, he must have deteriorated over time, it was thought, and it wasn't ever determined exactly what the private duty nurse was doing. Perhaps she was asleep, and boom, Andy Warhol routine operation, and is found dead.
You have another example?
Well, another example that people talk about a lot is drug overdoses. And Betty Ford is obviously a very famous person, prominent person who in the 1970s and 80s had a problem with alcoholism and then was getting a lot of prescription drugs from doctors, and eventually went public with this and formed the Betty Ford Center. And that's an instructive case because, again, all doctors will prescribe medicines that are, you know, sedatives and opiates that are potentially dangerous medicines, but we put a rein on ourselves and we say, you know, if a patient's asking for too many, there's something going on, we need to say something. But in her case, and in the case of other celebrities, again, I think the celebrity says, come on, can I please have a little more? Sometimes the celebrities actually go see multiple doctors, now, and the last thing you know, they got too many pills. Now
that's a specific problem, right, where you're seeing multiple doctors, and now we don't know what happened with Michael Jackson, but they're trying to figure out who actually were his doctors right now.
Yeah, and you know, I mean, I think, you know, if you've got 5 doctors or more doctors, you know, again, that should raise red flags. Most people have a couple of doctors, but right. If there's too many, there may be too many cooks.
And they may not be talking to each other, and especially if the celebrity is afraid that, you know, it's going to get out what's going on, he or she may have a specific private relationship with 5, say, different doctors. They don't know what the other one's prescribing now in the case of a drug overdose. What's the solution to this?
Well, one solution, I think, is what you do, which is to sort of acknowledge the issue up front and say that you want this to be a standard doctor-patient relationship. Another teaching point, I think, is if you're a famous person or your doctor taking care of a famous person, there should be one doctor who's in charge, right? So if there's a lot of doctors involved and you're getting a lot of specialists to see the person and you need a lot of input, there should still be one doctor who takes charge, who gets all the information, and could therefore be aware potentially of drug interactions or if things aren't going well.
Thanks so much to Dr. Baron Lerner for this very interesting and counterintuitive discussion about celebrity health. One would think that being a VIP would mean you would get better care all the time, but that's not necessarily true, as we've learned. Thanks so much for joining us, and please join us again next week for another episode of CBSDoc.com. For now, I'm Dr. Jon LaPook. Good day and good health.